very important chapter, and that is our retina, right? Now, retina is important. Yes, retina is important. Retina is important obviously because questions are asked from it. Retina is important as a structure in the eye because retina is containing rods and cone cells. Rods and cone cells are at last giving you vision. Yes, they are the cells, they are the photoreceptors which are converting light into visual image. So if your retina is damaged, you don't have vision. This is like the film of a camera. If you take out the film from a camera, the camera does not click photographs. Or these days, if you take out the memory card, basically, yes. So it is that part of your eye which is actually the most important, if I can say, though nothing is more important or less important. Yes. Now, retina students find difficult as far as my experience goes because retina is a large chapter. There are lots of conditions to study in retina. If you would have seen the schedule, you would have seen I would be taking almost around 7 to 8 hours to be able to complete retina. Even though I would be taking 7 to 8 hours, by the time I finish retina in almost around 4 to 5 sessions, you will realize once you get a hang of the concepts, retina is actually again an easy chapter. It is nothing to be afraid of. And that is what I will be trying to do with you. Trying to demist retina as a chapter, trying to make you approachable towards retina, not to fear retina. Okay. Basics in the retinal anatomy, histology. And then I will be telling you important investigations in the retina, so through which you will be able to understand how to diagnose a case of a retinal pathology. And there will be lots of images, OCT images, FFA images, images of fundus or images of investigations, which we are absolutely afraid of, right, guys? So this 2-hour session is a very entertaining session. I hope you'll stick along with me. If you do not have any other job, today being Sunday, I hope all of you are free and fine sitting at your homes, guys, right? Now, so without wasting any more time, let's begin with the retinal anatomy, okay? So to begin with retinal anatomy, I ask you one simple question, which I have taught in the second session of my course, that is in basic anatomy of the eye. What are the 3 gross anatomy parts of retina? 3 gross anatomy parts of retina. That means when you're looking at a photograph of the retina anatomically, grossly, or when you're looking at the retina yourself, what are the 3 parts you should focus at? If you would have seen my session, again, I will just like to remind you, the first thing you will see is optic disc. The second thing you will see is your macula. And the third thing you can see if you try to is ora serrata. Okay, everybody? I just like to remind you optic disc, macula, and ora serrata. What is ora serrata? Again, you would have to go back. Ora serrata is the peripheral limit. Okay, this is my retina. So this point, this point of retina, where my retina ends, this point of retina is called ora serrata. This point of retina is called ora serrata. The limit or the termination of retina peripherally is called ora serrata. If you remember the anatomy, this is my outermost layer, cornea, sclera, and limbus. Then this is my middle layer, guys. My middle layer is iris. Very rough diagram, very quick diagram, guys. This is my iris, ciliary body, and choroid. And then this layer is my retina. Now, if you would note, the retina is an incomplete layer. The retina starts from one point, it courses posteriorly, and then it ends another. Retina is an incomplete layer. So this point, everybody, this point is called as ora serrata. If you have not seen my basic anatomy lesson, okay, everybody. Now, what should we be able to do as an examiner or as a doctor when we examine the retina or when we examine the fundus? That's the main question. What do we examine? Do we examine the retina or do we examine the fundus? What is fundus? Everywhere we say fundus image. Fundus fluorescein angiography. Fundus is the word we use. So my question is, what is fundus? My question to all of you is, what is fundus? Anybody who knows what is fundus? What is this fundus? Nobody? Nobody? Fundus? Okay. If we don't know what is fundus, then before starting to read retina, that is the most important thing to do. We need to understand what is fundus. So everybody, let's say I give you a torch. Through a torch, I ask you to examine my eye. Everybody? Through the torch, I ask you to examine my eye. Will you be able to examine something in my eye? I'm asking you a very simple, decent question. Yes, obviously. When you will examine my eye through a torch, first of all, the light will fall onto the cornea. Yes, you can look at the cornea. Yes, if there is something fallen into the eye, there is some gross lesion on my cornea, you will be able to see. Are you able to see the iris through the cornea? Everybody, are you able to see the brown iris? Yes, you are able to see the pupil. The pupil can constrict, the pupil can dilate. That is seen through a torch light, pupillary light reflex. That means you can also see my iris. You can also see my pupil. Can you see the lens through a torchlight? Yes, again, in third year postings, we are taught to see the color of the cataract, pearly white, dirty white, gray white, whatever white, chalky white. Yes, if we are seeing the color of the cataract, that in short means we are looking at the lens. So I can say through a torchlight, I can look at the anterior segment. Through the torchlight, I can look at the anterior segment. But what about the posterior segment, guys? Posterior segment is comprised of outermost layer, sclera. Then here will come, I'm just drawing the posterior part. Here will come my choroid. Then this will be my rough diagram, guys. I hope you understand. Retina. And all this cavity is my vitreous. Through a torchlight, can anybody see a vitreous, a retina, or a choroid? No, you can't. That means to look at the posterior segment. All this is the posterior segment. Yes, I hope you understand. This is my posterior segment. That means to look at the posterior segment, I need to do some investigation. Which investigation do we do, everybody? I will teach you later on. The investigation that we do is called as ophthalmoscopy. The investigation that we do is called as ophthalmoscopy. Now, ophthalmoscopy, what do we do through an ophthalmoscopy? Just wait a second, guys. So if you've ever seen, this is an ophthalmoscope, guys. You can see an ophthalmoscope. Yes, this is an ophthalmoscope. This instrument we keep in front of one of our eye. Okay, and through this we are trying to look at the patient's eye. Yes, sir. Am I clear? This is an ophthalmoscope. This is an ophthalmoscope. See, everybody. Okay, so this is an ophthalmoscope. Done. Now, Through this ophthalmoscope, what am I trying to look at? Through this ophthalmoscope, I'm trying to look at the posterior segment. So in the posterior segment, what is the first thing I will see? The first thing I will see is vitreous. What is the color of vitreous, everybody? Vitreous is transparent. Because the vitreous is transparent, now I will look at the retina, number 2. Now my question to all of you, what is the color of retina? What is the color of retina? Anybody? I'm giving you options. The color of retina is red. The color of retina is orange. The color of retina is black. Or the color of retina is transparent. 4 options, guys. Anybody who can tell me what is the color of the Meet, Argha, Ishani, Mayank, Mitul, Saurabh, you have got it right. Some of you have got it wrong. I only get to know who is getting it right. I don't get to know who is getting it wrong, guys. Jinal has also got it right. I'm just waiting for the poll to finish, everybody. Somebody else has got it wrong now. Somebody else has marked the color as orange. Okay, and that's the poll finished for you. So 69% of the students who have answered this have got it right. You will be able to see the list probably on your screen. All of you have got it right, guys. 7 people. Then, guys, what is the color of the retina? If you've all got to know by now, it's okay. But otherwise, the answer is that the color of the retina is transparent. The color of the retina is what, everybody? Transparent. I hope we understand. The color of the retina is transparent. Okay. So vitreous was transparent. That is why we could see the retina. But now we know that the retina is also transparent. Because the retina is transparent, we will be able to see behind the retina. Behind the retina, what is the third structure we will see now, everybody? So the third structure we will see now will be choroid. Now, choroid is a part of uvea. If again we know or we remember the basic anatomy that I taught you, uvea is the vascular layer of the eye. That means uvea contains blood vessels. Blood vessels means large blood vessels, lots of blood. Lots of blood means choroid will look red in color. That's why I drawn it in red, everybody. Yes. So choroid is reddish or orangish in color. Now, whenever you have seen a retina photograph, you have actually not seen a retina photograph. What you have seen, everybody, you have seen a fundus photograph. So what is fundus, everybody? When I'm trying to look at the retina, I can't look at the retina alone because retina is transparent. I end up looking at all the structures of the vitreous together. What do I end up looking at? Number 1, vitreous transparent. Number 2, retina transparent. And number 3, choroid, which is red in color. So whenever I try to see the retina, I will see all these 3 structures together and this view of the posterior segment. You understand? A view of the posterior segment comprising of 3 structures: transparent vitreous, transparent retina, and red colored choroid. This is fundus. Are we clear, everybody, what is fundus? Are we clear, everybody? If yes, please just give me a thumbs up so that I know that you and me are interacting. Okay, everybody? This is a very basic but a very simple concept here, okay? So I'm writing now, everybody, for you, what is a fundus? What is fundus? Very good, guys. Thank you for the thumbs up. Thank you for letting me know that you understand. So fundus is a view of all the structures visible in the posterior segment together, namely A, vitreous, which is absolutely, as we know, transparent; B, retina, which again, as we have just got to know, if we didn't know it before, is also transparent; and C, choroid, which is reddish in color, I will say, because of the blood, reddish. Okay, that is why I can say the fundal reflex is red due to choroidal color. Okay, so please remember, the color of the retina is not red, but when we examine the retina, we see the fundus, and the fundal reflex is red in color due to the color of the choroid. Am I clear, everybody? I think half of our battle is won if we are able to understand this simple point. A lot of things in life become easy as far as retina chapter or retinal pathologies are concerned if you understand this very simple type of fundus and the difference between fundus and retina, guys. Okay, everybody? Now I'll just be bringing up a photograph on your screen, guys. As soon as I give you this photograph, I hope your life should become much more easier seeing this photograph. So let's see this image, guys, on the screen. Okay, everybody. So now we have the image on the screen. Let's see this. So my first question to you, everybody: this is a retina image or a fundus image? Is this a retina image or a fundus image? I hope you should not have any confusion now. I cannot have a retina image. I will always have a fundus image. Very good, Ash, for writing F, fundus image. Very good, guys. Okay. So this is a fundus image. Now, whenever I look at a fundus image, what am I trying to look at? Again, what am I trying to look at? I'm trying to look at the gross anatomy. I'm trying to look at the important parts of the retina. See, my view cannot visualize the whole of the retina together. Whatever I do, I will be only able to visualize a part of the retina or part of the fundus. Yes. So this is, or usually you will get photographs of the central fundus. So this is a photograph of the central fundus. As we understood a little while back, I hope you understood a little while back. Where is it? This, that ora serrata is a peripheral part. Ora serrata is a peripheral part. So you can't look at ora serrata in a central fundus photograph. What you can look at is optic disc and macula. Am I clear to everybody? Now moving on. So in this photograph, we should be able to look at the optic disc and the macula. Now, everybody, optic disc is a disc-shaped structure, which I hope is very clearly visible to all of you. I don't think there should be any confusion here. This is my optic disc. Am I clear to everybody? This is my optic disc. In the center of the optic disc, you will see a brighter yellow color. This is called as the optic cup. I will explain in detail later on. Okay, 5 minutes after. But right now we are trying to just look at the photograph of a fundus. In the fundus, we are trying to determine the parts of the retina. So this is my optic disc, the bigger circle. In the center, a bright yellow bulb called optic cup. Okay. So optic disc or optic cup is easily visible. I'll show you thousands of photographs. In all those 1,000 photographs, optic cup is the first thing you are able to, or optic disc is the first thing you are able to see. Now, the second question comes: how to look at the macula. So to look at the macula, we see that the blood vessels, whatever blood vessels are starting, they are basically starting from, if you see carefully, from the optic cup. Yes. So we say optic cup is the part from where the vessels come inside the eye. Now we trace the blood vessels. When we trace the large blood vessels, see, like I am tracing everybody, you will be able to see, like I am tracing this blood vessel. Similarly, if I go down, and if I go here, I will see blood vessels like this. So I see on one part of the retina there are straight vessels, but on the other part of the retina there are umbrella-like vessels or arcade of vessels, superior arcade of vessel and inferior arcade of vessels. Can you see everybody these chata type, umbrella type vessels? Yes. Now, why am I tracing these blood vessels? I am tracing these blood vessels to be able to determine the side of my retina, my orientation. Whichever side I am forming this arcade of blood vessel, that arcade is temporally located, and this becomes my nasal part of the retina. Am I clear till now, everybody? So first of all, we look at the optic disc. Then through that optic disc, we trace the blood vessels. When we trace the blood vessels, we find out that the arcade is formed towards which side of the retina? Temporal. As soon as I know this, I'm sure now what is the temporal side, which is the nasal side. Now I should know my basic anatomy, theory, fact, that macula is situated or fovea is situated to optic disc. That means fovea should be situated here, temporal to optic disc. But how to determine out of this large temporal side, which is my macula or fovea? So I move temporally, I encounter this area. Everybody, can we see this area? Everybody? Yes. In this area, I see that there are no blood vessels. Are there any blood vessels here? No, this is avascular. Can you see everybody? This is avascular blood vessels. See, all these blood vessels are present. All these blood vessels are present. Up, down, left, right, everywhere there are blood vessels. But in this area, there are no blood vessels. Whichever area appears avascular is your fovea or your macula, I can say. I hope you remember that fovea is the center of your macula. Am I clear, everybody? So if I just quickly revise it with you, first of all, we look at the optic disc. Then through the optic cup, we see the blood vessels. Whichever side the blood vessels are forming an umbrella, that becomes the temporal side. Temporally, my fovea and macula are located, and we determine fovea or macula by finding an avascular big area. Am I clear to everybody again? Okay. So I'll bring up another photograph and then I'll draw it for you guys. So I'll just bring up another photograph for you to be able to revise this on your own. Let's see whether you are able to. So everybody, let's see this photograph again. Can we make out the optic disc bright and clear, everybody? Yes, my pointer must be moving. Yes. So this is my optic disc, bright and clear, visible. This is my optic cup, bright yellow. Now I again trace my blood vessel. See where is the umbrella forming. See where is the umbrella forming. See where is the umbrella forming. So that means this side is now which side, guys? This side is my temporal side. This side is again my nasal side. So now I again move temporally. When I move temporally, I find this area. This area is avascular. There are no blood vessels. So this area must be my fovea. I hope again that you have no problem in this, everybody. Yes. Are we clear, everybody, on how to be able to visualize a fundus photograph in terms of normal anatomy, optic disc, blood vessels, and then the macula? Okay. Okay. I got one thumbs up. That means at least one student understands it. One student understands it. Very good, guys. I'll just rub it out. Now, through this photograph, I also want to explain to you. Through this photograph, I also want to explain to you how to differentiate between an artery and a vein. Okay. Now, everybody, you will be able to see two blood vessels. Everything is marked already, but still, I'm trying to discuss it with you so that you don't have any problem. This is number one. This is number two. Number one, number two. Can you see everybody two blood vessels? What is the difference in these two blood vessels? Number one blood vessel is, I can say, having a larger caliber and it is dark red, whereas number two blood vessel is having a smaller caliber and it is brighter red or lighter red. Can I say these two differences? Everybody, look at number one, it is darker red or maroon in color and it is bigger caliber or larger caliber, means the inner diameter is more. Yes, larger caliber. Now the number two arteries looks thinner, or I can say smaller caliber, and it has a brighter red color. So we know that number one, veins are larger. Yes. Number two, in terms of the caliber, and number two, we know that veins carry impure blood. Impure blood means dark red in color. So that means number one structure is our vein. So number one structure is our vein. Number two structure should be our artery, because it is carrying pure blood, so it should be brighter and it should be smaller in color. I again hope you understand how to differentiate between a vein and an artery. You should have no confusion. If you have any confusion, just remember one question. AV. So 2:3 is the normal AV ratio in the body. Please do remember this. Okay. This question is asked as basic anatomy. Again, am I glad everybody here? Yes. So that's how you look at a normal fundus photograph. Now I will just draw this normal fundus photograph for you of what you need to remember if you want to draw it. So first of all, this is my optic disc. This is my optic cup. Okay. Now through the optic cup, as I explained to you, blood vessels come out, artery and vein, artery and vein. Whichever side my blood vessels come out, that side becomes my temporal side. The other side becomes my nasal side. Now, if I complete, there will be branches of blood vessels. There will be branches of blood vessels everywhere, barring a small area in the center. I'll just mark it with purple color. This area. This area is your fovea, I can say, or your macula. Why is it your fovea or macula? As it is avascular. That's how you identify it. Am I clear to everybody? Now, if I just try to write in detail the anatomy of the optic disc for you. Optic disc is having two parts. One part which I marked in orange, and the other part which I am marking with blue colored dots for the lack of any other color. For the lack of any other color. So this blue area is called as optic disc. No, sorry, optic cup. My mistake. Optic cup. Whereas this orange area is called as NRR, neuroretinal ring. Neuroretinal ring. Okay. Am I clear till now, everybody? Then, very simple. What is the distance between optic disc and fovea? Question. distance between optic disc and fovea? The answer is 2dd. dd means disc diameter, which is equal to 3 mm. What is the distance between optic disc and fovea? What is the distance between optic disc and fovea? 2dd, or 2 disc diameters, which is equal to 3 mm. Okay. As soon as I know this, my second question is, what is the diameter of optic disc? I hope you can do maths now and tell me. The distance between optic disc and fovea is 2 disc diameters or 3 mm. So what is the diameter of optic disc? Very maths, yeah. Distance between optic disc and fovea is 2dd or 3 mm. So the diameter of optic disc should be 1.5 mm. Very good, Argha Saha. Very good for doing simple maths for me, guys. So the diameter of optic disc is 1.5 mm. Am I clear till now, everybody? Very basic anatomy I'm discussing. I've taken half an hour to do this with you. I hope you are getting it, guys. Yes? Okay. Now let's understand the two parts of optic disc, guys. There are two parts of optic disc: neuroretinal rim. Optic cup. What do we understand from neuroretinal rim means periphery? So we are saying that all the nerve fibers of the retina, everybody, I hope again you've seen my videos and you understand this. This is my retina, this is my optic disc. Yes. So throughout the retina, all the nerve fibers come and collect at the optic disc or the optic nerve. But they don't collect in the whole optic disc. They collect only in the periphery of the optic disc. So this orange colored area, all the nerve fibers of the optic disc have collected. Yes. And all these fibers are together known as neuroretinal rim. But in the center, there is a hollow area which is left. Optic cup. There is a hollow area which is left. Optic cup. Why is this hollow area left? Do you understand? Because the blood vessels are coming in. Yes. So through this hollow area, the blood vessels come in and supply the retina. The blood vessels come in and supply the retina. Similarly, the veins will go out. The red artery will come in. The vein will go out. Okay, everybody. So optic cup is a shallow area or a hollow area through which the vessels come in and the vessels go out. Are we clear? Okay. Now, neuroretinal rim is thickest inferiorly. Neuroretinal rim is thickest inferiorly. ISNT. The thickness follows this rule. This is the thickest, and the thinnest is, I hope you understand, temporally. Okay. So ISNT, isn't rule. Okay, everybody? Isn't rule, we call it. So for the thickness of neuroretinal rim, we have the isn't rule. Inferior, thickest. So it becomes actually a 4. Inferior, superior, nasal, temporal. If you follow the thickness. Okay, everybody? Inferior, superior, nasal, and temporal. Isn't rule. That is the thickness of my neuroretinal rim. I hope we are clear again, everybody. I hope we are clear here, everybody. There should be no confusion about this. That's all about my basic anatomy of the optic disc and my basic anatomy as far as understanding of photograph and drawing it is concerned. One of the persons has given me this kind of a smiley, Mitul. I don't know what this means. Does this mean you are not understanding anything? I don't know. If you are not, just please feel free to mention the doubt that you have rather than posting this smiley to me. Okay, no problem. Anyways, guys, done. Okay, so that's all about the basic anatomy from my side. Now, if I just discuss macula in a little detail with you, so that's my diagram. If I discuss macula in a little detail with you, I will say this is my macula. The center of my macula is called my, I just draw it smaller actually. The center of my macula is called the foveola, and the center of the foveola is called the umbo. So if I just mark it for you, this is my macula, equal to 5.55 mm. The center of my macula is my fovea, equal to 1.85 mm. The center of my fovea is the green color, foveola, is equal to 0.35 mm. And the center of my foveola is my this black dot, everybody, which you can see. This is called as umbo. This is called as umbo. Okay, this is called as umbo. This is responsible for foveolar reflex. This is responsible for foveolar reflex. I hope we understand this simple thing first of all. If we do, then I'll try to explain this to you. So the large area is called the macula. Then the center of macula is called the fovea, foveola, and umbo. Now, umbo is a very small area and it's a very sharp depression. So when we are doing our ophthalmoscopy, guys, when we are doing our ophthalmoscopy and when we throw light onto it, so this sharp depression will reflect light back, and this sharp depression called umbo will reflect, will shine. So we call or we say that at the center of the macula or the fovea or the fovula, there's a sharp reflex that we get. And that sharp reflex of light is called as foveolar reflex. I hope you understand. If there's a depression, the light will go into that depression and will reflect back to us. Okay. So this reflection is called as foveolar reflex. Even though the name is foveolar reflex, it actually is generated from the centralmost point that is called the umbo. Okay, everybody. Now, very important point about fovea. Very important point about fovea. Okay, everybody. At fovea, ganglion cell layer and inner nuclear layer are absent. I will explain the layers to you in the next 5 minutes. Then you will be able to understand it completely. Just remember right now that at the fovea, ganglion cell layer and inner nuclear layer are absent. Okay. Fovea. I hope you already know about fovea. That fovea is the most sensitive part of the retina. That's a simple MCQ. Fovea is the most sensitive part of retina. I hope there's no confusion about this fovea. Okay, done. So that's your simple anatomy of macular regions. Again, I hope there is no confusion in all of this that I have tried to tell you till now. I tried to tell you how to see an image, how to look at the optic disc, what is optic disc, optic cup, NRR, how to visualize the macula, fovea, foveola, umbo. Most sensitive means it has the highest visual acuity because it only has cones. So it's like the pixels. The more pixels there are in your mobile screen, the sharper image you see. So at the fovea, there is maximum concentration of cones. So the distance between each cone is less. So the pixels are more, basically, you can say. Yes, the cones are more or the pixels are more. So the sensitivity of the image, the sharpness of the image, the brightness of the image, the visual acuity is most at fovea. And that is why ASH, we call it the most sensitive part of the retina. Okay, everybody? Done? Okay, everybody, good. So now that's about my gross anatomy. I can't go deeper into the gross anatomy. Otherwise, I'll spend 5 more hours in gross anatomy only. That's all about the gross anatomy of the retina. Now we begin with the layers of the retina. If you've been able to understand the gross anatomy, now we begin with the layers of retina. Okay, guys. I'm loving it. All of you are replying. All of you are asking me doubts. That's the best way to study. That's the best way to teach. I also enjoy as a teacher when I'm teaching like this. Very good, guys. Keep it up. Okay, layers of retina. How many layers are there in retina? So how many layers are there in retina? 7, 8, 9, or 10? 7, 8, 9, or 10. A, B, C, D, everybody. A, B, C, D. The poll has started. How many layers are there in retina? 7, 8, 9, or 10? Quickly. 7, 8, 9, or 10? 7, 8, 9, or 10? Okay. There's somebody who's answered it wrong, actually. I'm surprised, guys. There are 2 people who have answered it wrong. I'm surprised. I am surprised. I'm thoroughly surprised, guys. There are 2 people who have answered wrongly. Shubhaji, Tishani, Nanda, Mitul, Jinali, Argaha, Ajay Kumar, Meet, Doshi, Saurabh, and Sarath. All of you have answered it correctly, but there are 2 people who answered 8. Guys, you can't make this mistake. This is too basic a question. So how many layers are there in retina? Please remember, there is no confusion over this whatsoever. There are 10 layers in retina. There are 10 layers in retina. Okay, everybody? Now, again, sir, I'll go back to the class of anatomy. I again don't know whether you have seen my anatomy classes or not. Okay, so this is my cornea. This is my sclera, iris, and lens. The basic diagram I keep on drawing again and again. And let's say this is my retina. I'm just drawing my retina as a thick wedge. This is my cornea. I have again drawn my cornea as a thick wedge. As I have explained in my basic anatomy class also, we always discuss the layers from anterior to posterior. See, students like us, when I was also a student, I used to say layer number 1, layer number 2, layer number 3. So what do we mean by layer number 1? Layer number 1 should always mean the anterior layer. Layer number last, or layer number 10 in this case, should mean the posterior layer. If we are talking about the cornea, this is the anterior layer, this is the posterior layer. But if we look at the cornea, anterior layer is outside the eye and posterior layer is inside the eye. So when we study the layers of the cornea, we study from outside to inside, okay? Anterior to posterior. But now look at the retina, everybody. This is the anterior layer, this is the posterior layer. Anterior layer, now everybody tell me, is inside the eye or is outside the eye? Everybody. Anterior layer is inside or outside the eye? Anterior layer is inside the eye or outside the eye? Inside the eye, Ash and Argaha, very good. And posterior layer is outside. So for retina, actually, when we need to learn the layers, we need to learn from inside to outside. We need to learn from inside to outside. I hope you understand what I'm trying to tell you. So please, whenever we are learning the layers, always learn from anterior to posterior. If you understand the anatomy, you will never mistake these things, because these are the little things you keep getting confused in, and because you're confused in these little things, you're never able to understand the important topics or the important diseases or the explanations of the diseases, right, guys? So if in another word I say, if my vitreous is present, my vitreous touches which layer of the retina? My vitreous touches inner layer of retina. Then this is my outer layer of retina. So my outer layer of retina will touch what, everybody? Choroid. Again, I hope you understand what I'm trying to do. Yes, vitreous will touch the innermost layer of retina, and the outermost layer of retina will touch my choroid. Am I clear to everybody here? Yes, very good, guys. So when I discuss the layers of the retina with you, I will be discussing from inside to outside, from anterior to posterior. Now, if you understand this very basic logic, everybody, this is the innermost layer. I hope you understand now. When you examine my retina, let's say you are looking at my retina, this is the innermost layer, this is the outermost layer, and behind the outermost layer will come my choroid. So this is my choroid, this is my retina. Yes, guys. Okay, very good, guys. Moving on, let's discuss the layers of the retina from inside to outside. So innermost layer. Innermost layer is I for internal limiting membrane. Internal limiting membrane. Internal limiting membrane is a true basement membrane. Internal limiting membrane is a true basement membrane formed by footplates of Muller cells. formed by footplates of Muller cells. Then the second layer comes N for nerve fiber layer. Nerve fiber layer. I hope you understand this. There is no confusion. Nerve fiber, all the nerve fibers of the retina. Nerve fiber layer. Then the third layer is ganglion cell layer. From the name itself, it should be very clear. These contains ganglion cells. Ganglion cells are which order neurons? Anybody who will like to tell me? Ganglion cells are third order neurons of visual pathway. Ganglion cells are third order neurons of visual pathway. Then after ganglion cell comes I again, inner plexiform layer. Then comes I, inner nuclear layer. Inner nuclear layer contains, very important, inner nuclear layer contains bipolar cells. Bipolar cells form the second order neurons. Bipolar cells form the second order neurons. Am I clear till now? Yes? Now, everybody focus on this word. What is the word, everybody? The word is plexiform. What do you mean by plexiform? Plex means synapse. Plex means synapse. So what do we see? Above the plexiform layer is my third order neuron. Below the plexiform layer is my second order neuron. So what is the meaning of plexiform? The meaning of plexiform is synapse. So if I ask you what is the function of third order neuron and second order neuron, synapse, plexiform layer, so you will say the function of the plexiform layer inner is synapse between ganglion cell layer or ganglion cells and bipolar cells. You understand? So the function of inner plexiform layer is to synapse between the third order neuron and the second order neuron to be able to relay the information, or I can say in simple words, synapse between ganglion cells and bipolar cells. Are we clear here, everybody? Done? Done till now? Yes, very good. Okay. So now if I move on, I will change on to my next page because of the lack of space here. So now when I change, I will write the 6 layers. So we have done number 1, number 2, number 3, number 4, number 5. So now comes O. O for outer plexiform layer. Then again O for outer nuclear layer. O for outer nuclear layer. Okay. Outer nuclear layer is also called, outer plexiform layer is also called as Henle's layer. Okay. So outer plexiform layer is also called as Henle's layer, guys. Am I clear, everybody? There should be no confusion about this. Outer nuclear layer. What does outer nuclear layer contain? It contains nuclei of rods and cones. It contains nuclei of rods and cones. Okay. Okay. Then next layer, E. E for external limiting membrane. Then P. P for photoreceptors. Photoreceptors basically means, I hope you know again, there should be no confusion. Photoreceptors are rods and cones. Rods and cones are the first order neurons. They are the first order neurons. Okay. So now if you're noticing, guys, again we had a plexiform layer. What was the plexiform layer? Outer plexiform. Now outer plexiform layer lies between which neurons? Below outer plexiform layer is first order neuron, and above outer plexiform layer, everybody, if I go back to the previous page, above outer plexiform layer was second order neuron. Yes. So outer plexiform layer is forming a synapse between bipolar cells and photoreceptors. I hope you understand now. Okay, everybody, there are 3 cells: ganglion cell, bipolar cell, and look at my fingers, ganglion cell, bipolar cell, and photoreceptors. So there will be a synapse between this ganglion cell and bipolar cell. This will be in which layer? Inner plexiform. Then there will be a synapse between bipolar cell and photoreceptors. This will be in which layer? Outer plexiform. So 3 layers of cells, 2 synapse. Synapse number 1, synapse number 2. First order, second order, synapse. Second order, third order, synapse. Forms outer blood retinal barrier. It forms outer blood retinal barrier. Outer blood retinal barrier. Okay, I'll explain it to you, don't worry. Please remember one very important point about external limiting membrane. It is a false basement membrane. It is a false basement membrane. The inner limiting membrane or the internal limiting membrane is a true basement membrane, but the external limiting membrane is a false basement membrane. Okay. Done, everybody? I hope there's no confusion here. I hope we are clear. I hope we are clear. To summarize, if I want to summarize it for you, I will just simply say that this is my retina. Everybody, these are the inner 9 layers. Inner 9 layers are sandwiched together or packed together. Inner 9 layers which are sandwiched together are known as neurosensory retina. Inner 9 layers which are packed together are known as neurosensory retina. The outermost layer, you already know, the outermost layer is called the retinal pigment epithelium. I'll answer your question, Arga Saha, in a while. Outermost layer is retinal pigment epithelium. So I just write down the short form. This is what I will use, RPENSR. Okay, RPENSR. Now, what do we notice? We notice that the inner 9 layers are sandwiched together, known as neurosensory retina, but the outermost layer is separated from the inner 9 layers by a space. Can you see everybody this space? My question to you, what is this space known as? The space between neurosensory retina and retinal pigment epithelium is known as. The space between neurosensory retina and retinal pigment epithelium is known as subretinal space. Is known as subretinal space. See, it is an important point because it is subretinal space. If I just hear the word subretinal space without knowing the meaning of it, I would say subretinal. Subretinal means below the retina. But subretinal space, even though it is termed subretinal, it is kind of a misnomer. Actually, it is not below the retina. Actually, it is between the retinal layers. It is below neurosensory retina, but above the outermost layer, that is retinal pigment epithelium. So, if whenever I wanted to remember retinal anatomy in my MBBS, I remember it like this. Everybody, this is my retina. These are my inner 9 layers sandwiched together. Can you see inner 9 layers sandwiched together? Yes. So this is my neurosensory retina. Then this patla layer, this small patla layer is my pigment epithelium separated by a space, and this space is known as subretinal space. So this is my retina. I always used to hold my hands like this to be able to remember my retina. I hope you also do the same. So this is my retina. Neurosensory retina, pigment epithelium, subretinal space. Neurosensory pigment epithelium, subretinal space. I hope you're clear here, everybody. Now, just 2 minutes back, we said that. The function of retinal pigment epithelium is it forms the outer blood retinal barrier. People may not have heard of blood retinal barrier. We have heard of blood brain barrier, yes. So just like there is a barrier in the brain which does not allow the blood to come inside the brain, this pigment epithelium forms the blood retinal barrier. Why? Again, this is the outermost layer. Below the outermost layer is what, everybody? Choroid. Choroid has large blood vessels. These large blood vessels want to transudate, exudate, hemorrhage, everything in which space? Subretinal space. So all the liquid, the blood from the choroidal blood vessels wants to keep entering the subretinal space. So what is the function of the pigment epithelium? It stops all this fluid and blood from coming inside the subretinal space. And that is why we say the RPE forms the outer blood retinal barrier. Retinal detachment, diseases like CSR, diseases like CME, everything becomes easier to remember. Now, I'll go back to the layers. There are 10 layers. How to remember the names of the 10 layers? I'll give you a mnemonic. The mnemonic is, the first layer was I, internal limiting membrane. The second layer was N, nerve fiber layer. The third layer was G, ganglion cell layer. ING, ing, ING. Okay. You understand ING bank? There was a bank called ING Vaishya. If you don't, then I'm talking to you. You are not replying to me. You people are boring right now. Okay. So ING, whichever way you can say, guys. ING, I2, inner plexiform, inner nuclear. O2, outer plexiform, outer nuclear. Then E, external limiting membrane. Then P2, photoreceptors and pigment epithelium. Now, what does this become? If I simplify it, please remember that the only useless layer is the external limiting membrane, because as I told you, it is a false basement membrane. It has no function. So if I forget the external limiting membrane, my mnemonic becomes a beautiful mnemonic. ING, intraocular pressure into 2. If we remember this, we are able to remember layer wise at least 9 layers of the retina. ING, IOP2. ING, IOP2. If you can remember E, please do remember E also, but at least these 9 layers are important to remember as such. I hope you understand. Now, Arga Saha, you have asked me a question. What is the difference between true and false basement membrane? So, true basement membranes are pass positive, false basement membranes are pass negative. That is the basic way to understand the difference. Functionally, a true basement membrane is acting as a barrier, but a false basement membrane is not acting as a barrier. That's the basic difference. Okay. Okay, guys. Now, I'll ask you a question. I'll go back here. We have just written that our first order neuron, second order neuron, and third order neuron. We have just written our third order neuron is ganglion cell layer. So I ask you, nerve fiber layer. What is nerve fiber layer? See, when the impulse goes from ganglion cell layer to nerve fiber layer, all the nerve fibers of the retina will collect and they will form what, everybody? All the nerve fibers of the retina will collect and they will form the optic nerve. Am I correct? So my question to you, optic nerve is which order neuron? Optic nerve is which order neuron? Third order or fourth order? Optic nerve is which order neuron? Third order or fourth order? Anybody? Optic nerve is third order neuron or fourth order? Option A, option B. Optic nerve is which order neuron? Third order or fourth order? Quickly, guys. Okay, Meet, Doshi, Sarath, Ishani, Mitul, Saurabh, Ajay, Shubhajit, you are all answering it correctly. Somebody has answered it as C. There is no C option, guys. There is only third order and fourth order. Please don't answer C. There are only 2 options: third order, fourth order. Option A or option B. Third order or fourth order. Option A or option B. Optic nerve is which order neuron? Option A or option B. Third order or fourth order. Okay, very good, guys. So optic nerve is also, as a lot of you answered correctly, optic nerve is also a third order neuron. Sorry, optic nerve is also a third order neuron. So that means ganglion cell and optic nerve both are third order neurons. Everybody. So please remember the structure of a neuron. This is a cell body and this is the axon. I hope a very rough diagram is. So the cell body is ganglion cell and the axons of ganglion cells are nerve fibers. The axons of ganglion cells are nerve fibers. So nerve fibers are axons of ganglion cells. So ganglion cell and nerve fibers are actually the same neuron. That is the third order neuron. One is the cell body and one is the axon. I hope it is very clear to all of you again. I hope you will not do a mistake in this. This question has been asked. There have been some confusion in students' mind. I don't know why. So I will just write it for you once again. That your first order neuron is your photoreceptors. Then from photoreceptors, we go on to our bipolar cells. Bipolar cell becomes the second order neuron. Then from bipolar cell, we move on to the ganglion cells or ganglion cells, optic nerve, from optic nerve, optic chiasma, optic tract, lateral geniculate body.